So many emotions can be wrapped up in one little blanket. You might be feeling everything from joy to a little anxiety when you think about taking your precious baby home from the neonatal intensive care unit. Caring for a baby with bronchopulmonary dysplasia, or BPD, might be scary at first, but you've already learned a lot in the neonatal intensive care unit. And now, we'll review some important information for your baby's home care. Bronchopulmonary dysplasia is a chronic lung disease that typically happens in babies during the first months of life if they are born too early and their lungs aren't fully developed, but it can occur in any baby. BPD makes breathing more difficult. A simple illness, such as the common cold, can make children with BPD very sick. However, this lung disease can get better in the first 2 or 3 years. Healthy tissue can actually replace scar tissue as your child grows. That's why proper growth and development are so important. And we're here to help you along the way. We offer the BPD Clinic, where your child will be seen by a variety of medical experts. You'll have the opportunity to ask questions, get information, and stay up to date on your child's development. Right now, the most important job you have is making sure your child has the best care at home. We recommend the following plan. Give treatments and medications that are needed to improve breathing and lung function. Give oxygen. Most children with BPD need extra oxygen for many months. It's the best medicine to help your child breathe better, prevent heart strain, and grow. Normal activities like eating, crying, and playing make your child work harder to breathe. Smoking and vaping also make it harder for your child to breathe. Smoking anywhere near an oxygen tank is very dangerous because oxygen is very flammable. Provide adequate nutrition to promote catch-up growth and lung development. Prevent illnesses through immunizations and hand washing. Provide activities to promote physical and mental development. And finally, educate the entire family on what is needed to properly care for your child. Now let's look at a few of these in greater detail, beginning with oxygen. Doctors will make sure the amount of oxygen your child is getting is the lowest amount possible for breathing easier, eating well, and growing. Oxygen is a medication, so do not stop giving it unless your lung doctor says it's safe. There are several ways your child may receive the oxygen required: through a home oxygen system, an oxygen concentrator, or a portable oxygen tank. If home oxygen is needed, a special home care company will bring you the supplies and equipment. You'll actually learn how to use this equipment before you go home. The home care company will also provide training on the safe use of the equipment and will show you how to maintain your equipment and supplies. You'll have this source of oxygen in your home as well as portable oxygen for travel. These companies provide 24-hour service in case something breaks or you need help. Now, let's talk about oxygen concentrators. These devices are about the size of a kitchen trash can. They can be conveniently moved around in your home because they plug into wall outlets. Concentrators pull oxygen from room air, separate it from other gases, and give almost pure oxygen to the child. Some children require more oxygen when using the concentrator than they do with portable oxygen tanks. Tanks provide pure oxygen, concentrators don't. When you're away from the home concentrator, or if there's a power outage, oxygen tanks will be needed. Tanks hold oxygen in gas form under high pressure. They come in many sizes. Insurance companies pay for a limited number of portable tanks to be used for doctor's appointments and therapy visits. So it's very important to use these tanks only when necessary. All oxygen systems have a flow meter to adjust how much oxygen is given. When using the portable tank, you must first use the tank key to turn the oxygen on. When it's on, the pressure gauge should move up. Now you can adjust the flow meter according to your child's oxygen setting. If you're unsure about operating your concentrator or portable tanks, please call the number on your medical equipment. To help you be sure your child is stable, monitors will be used. There's no need to panic when a monitor alerts you. An oxygen saturation monitor watches heart rate and blood oxygen levels. The probe is usually put on a toe or foot. These can be set off by certain movements, disconnected probes, low battery, or distress. But these let you know when you need to assess your child. The monitor will alarm when the blood oxygen level or heart rate drop below the acceptable level. Low saturations are a concern, as these can be damaging to the heart and lungs. Your doctor will give you a goal saturation level to maintain. Monitors should be used regularly until discontinued by your doctor. Now, let's move on to medications. Children with BPD need bronchodilators, anti-inflammatories or steroids, and diuretics. Bronchodilators immediately make breathing easier by relaxing the muscles in the airways. This medication is referred to as quick relief medication. Anti-inflammatory medicines or steroids help decrease swelling in the airways. These medicines work over time and must be given regularly to be effective. Diuretics help keep extra fluid off the lungs or heart. These should never be stopped suddenly. In fact, never stop any medications before talking with your child's doctor, as this can be very dangerous. Some medicines have to be mixed or compounded. Not all stores can do this, and sometimes it does cost more. Ask your drugstore if they can compound. If they can't, the nursing staff will help you choose a drugstore before you go home. It's important to choose one drugstore and use it for all of your child's prescriptions. When the medication begins to run out, you can return to the same drugstore for refills. Call the drugstore 2 days before you need the medicine to give them time to mix it. Don't let medications run out. This can be dangerous for children with BPD. And be sure you always bring your child's medicine or a cell phone photo of the current prescription label with you when you come to the clinic. By now, you know how important proper growth and development are for your baby, and nutrition is vital to this. Helping your child grow 1/2 to 1 ounce every day helps the lungs repair and grow. Babies with BPD usually need special formula. They also need more calories for catch-up growth and lung healing. If you're using formula, your baby may need a premature type formula. This may need to be mixed differently than the instructions on the can to provide increased calories. If your baby requires more calories, you will be given special mixing instructions before you leave the hospital. Be sure you know how to mix your baby's formula. Careless mixing can be dangerous. And do not give tea, water, or juices to your baby. Your baby only needs the formula. Never change your baby's formula unless you're told to do so by the doctor. Now let's review things you can do to promote your child's growth. Be sure your child is using the oxygen as ordered by the doctor. Lack of oxygen slows weight gain. When you mix your child's formula, follow the directions given by the nutritionist. And be sure to tell your child's doctor about any feeding problems your child might be having. Sometimes babies who have BPD have to go back into the hospital. Avoiding the common cold is one way to help prevent this. Here are some tips. Stay away from crowded places. Stay away from sick people. Have everyone wash their hands. Hand washing is the most crucial thing you can do to prevent illness. Keep hand sanitizer readily available when away from home. Avoid daycare. Children in daycare centers share illnesses. If you must return to work or school, you will need to find an alternate caregiver. And be sure your child receives Synagis monthly from October to March, and a flu shot annually beginning at 6 months old. This vaccine will help protect your child from respiratory syncytial virus, or RSV. It's a lung infection that can make premature babies and children with BPD very sick. RSV is most common in late fall to early spring. RSV is spread by physical contact, such as kissing or touching an infected person, by sneezing and coughing, and can be spread by people who aren't even sick. People can be exposed to RSV and give it to others without knowing it. Exposure is common in crowded places, crowded living spaces, and daycare centers. This virus can live for hours on counters, shopping carts, toys, cloth blankets, and used tissues. It's important to get the vaccine monthly during the RSV season. So how will you know when your baby is sick? The best way is to know your baby's behavior when he or she is well, so that you can compare. Babies change the way they act when they're sick, starting to get sick, or when they need more oxygen. Is your baby sluggish or floppy, sleeping through feedings, becoming tired easier than usual, more irritable than usual? Check breathing by counting breaths. Look at your child's tummy. An up and down series equals 1 breath. Put your hand lightly on your child's tummy or chest and count breaths for 1 minute. Is there a lot of coughing? Is difficulty breathing making it hard to suck a bottle? Is breathing noisy like grunting or wheezing? Is the skin sinking in more than usual around the ribs or collarbone? Is the child pale or blue around the mouth, nose, hands, or feet? Is there sweating? Is urine output normal? If your baby has increased breathing distress or color change that doesn't get better with usual calming efforts, do these things. Check all oxygen connections to be sure the nasal cannula is not blocked or plugged. Give albuterol in the form of a breathing treatment or inhaler if available. Turn up the oxygen. If breathing improves, notify your lung doctor that your child needs more oxygen than usual to keep saturations within the acceptable range. If your baby does not get better, stay calm and call 911. Always tell the doctor when you think or feel something is wrong, and be sure to keep phone numbers close by. Write them by your phone and carry them in a diaper bag so you or the sitter can call the doctor quickly if needed. Also, keep your home address near the phone in case a sitter needs to give the location of your home in an emergency. You need to go to a pediatrician near your home for regular checkups, shots, and minor health concerns such as fevers and ear infections. And also, have a doctor who is a lung specialist. This can be a pulmonary doctor or nurse practitioner, and they will see your baby in BPD clinic every 2 to 3 months or so. The lung specialist will adjust the oxygen, medicines, nutritional plan, and treatments used to treat BPD. Your pediatrician and your lung specialist will work together to take care of your baby. Finally, let's talk about ways to make your home safe and healthy for your baby. Safe sleep is important. Don't use pillows, rolls, bumper pads, or thick fluffy covers in your baby's bed. Dress the baby warmly enough to avoid using extra blankets. No toys or stuffed animals in the bed. Use a flat, firm mattress. Always put your baby on his or her back when sleeping. It has been proven that this helps prevent sudden infant death syndrome. Always follow the ABCs of putting your baby to bed: alone, on the back, and in a crib, unless instructed otherwise by your doctor. Never permit smoking inside your home. Exposure to cigar or cigarette smoke is the worst thing for your child's lungs, and smoking near oxygen tanks is very dangerous. Smoke prevents lungs from healing from BPD. If you do smoke and can't quit right now, always smoke outside and away from your baby. Never smoke in the car. Quitting smoking is an active, conscious process. It doesn't happen overnight. It means you must continually remind yourself why you want to quit. Get family and friends to help you. For additional help, call the Tobacco Quit line at 1-800-QUIT-NOW. That's 1-800-784-8669. You've received a lot of information on caring for your baby with BPD. Your attention, time, and patience will pay off. Years ago, children who needed oxygen stayed in the hospital. Today, parents can take care of their child on oxygen at home. And research shows that babies grow and develop much faster at home with families. With your dedication and hard work, plus a commitment by the whole family, you can make a difference in your child's life.